Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I know I've missed several appointments, and I stopped all medications. It started because of these headaches. They felt so severe, almost migraine-like, and I thought it was the medications causing them.
It's important to discuss any side effects you're experiencing, but abruptly stopping your medications can be very risky, especially considering your heart condition and your stent. Let's talk more about these headaches. When did they start becoming noticeable?
They've been on and off for a while, but they got really intense about a month ago. That's around when I stopped the medications. They get worse when I cough or when I'm outside in the sunlight, which is really bothersome.
Have there been any other new or worsening symptoms besides the headaches and sensitivity to light?
Yes, my legs. They just don't hold up like they used to. After walking just a short distance, they give out. I used to walk my dog around the block, but now I can hardly make it halfway.
And you mentioned you've started smoking again. Can you tell me more about that and any other lifestyle factors that might be affecting your health?
I picked up smoking again during a really stressful time a few months back. I'm down to about half a pack every 2 or 3 days. I know it's bad, especially with my history, but sometimes it feels like it's the only thing that helps with the stress.
Smoking can significantly impact your cardiovascular health, which is crucial for someone with your medical history. It could actually be contributing to your symptoms by affecting your blood circulation. Let's also talk about your recent vital signs and lab results. Your blood pressure today is quite high at 179/98, and your cholesterol levels are also elevated. This puts you at a significant risk of another cardiac event.
I understand all that, but the side effects from those medications, I just couldn't handle them anymore. I felt worse on them than off.
I hear your concerns, and it's important that we address them. What we can do is reintroduce your medications slowly, at lower dosages, and monitor how you respond. It's crucial, especially for the Plavix, to ensure your stent remains functional. We need to manage both your blood pressure and cholesterol more effectively.
I'm willing to try that, but I'm really worried about experiencing those side effects again. They made it difficult to even get through the day.
We'll start with the lowest dose of Plavix and 1 blood pressure medication. We need to monitor you closely and adjust as necessary. It's a process, but I'm confident we can find a regimen that works for you without the debilitating side effects.
What about my mobility issues? It's getting really hard to move around, and it's affecting my ability to work.
Your mobility issues are concerning, and they may be linked to your overall cardiovascular health. Improving your heart function might help with your strength and endurance. Physical therapy could also be beneficial here, and I'll refer you to a specialist who can tailor a program to your specific needs.
And the disability documentation, I need to renew it given all these issues. It's becoming increasingly difficult to manage my job requirements.
I will help you with the disability paperwork. It's crucial that your documents accurately reflect your current health status and how it's impacting your daily activities and work. Let's ensure this is taken care of.
Thanks, doctor. I just want to feel better and manage my day-to-day life without all these complications.
I understand, and I'm here to help you through this. Please keep me informed about how you're feeling, especially after restarting the medications. It's important to manage any adverse effects immediately. Let's set up a follow-up in 2 weeks, and here's my contact number for any urgent concerns.
I appreciate that. I'll give this plan a try and keep in touch about how things go.
That sounds good. Remember, managing your health is a team effort, and I'm here to support you. I'm glad we could meet today to discuss your concerns and plan moving forward.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling these new chest pains over the last few days. They're sharp, come quickly, and disappear just as fast. I'm not sure, but I think it might just be because of this cold I caught. My nose has been running, and I had a bit of a fever the other night. Nothing severe, but it's uncomfortable.
I understand your concerns, especially with your history of heart issues. When you mention chest pain, it's important we look into it thoroughly. How would you describe this pain compared to what you experienced with your heart attack?
It's totally different from before. Last time, it was more like a heavy feeling, like something was pressing on my chest. This time, it's more like a quick burn that doesn't last. No dizziness or nausea either, just the burn.
Okay, that's good to hear. It's not similar to your previous heart symptoms. I see that your diabetes has been quite uncontrolled recently. Could you tell me more about your medication routine and any challenges you're facing there?
Well, I've been pretty forgetful with my metformin doses in the evening. I guess with everything going on at home, it just slips my mind sometimes. My wife tries to help me keep on track with the diet, lots of vegetables and healthy meals, but the medication is something I tend to miss.
That's something we need to address, especially as we're discussing the possibility of starting insulin therapy. Have you had any thoughts or concerns about that?
To be honest, I'm a bit worried about starting insulin. I've heard it can lead to more weight gain, and managing injections is something new for me. But I know my sugar levels haven't been great, and something needs to change.
That makes sense, and it's completely normal to have concerns about starting a new treatment. It's good that your wife is involved and that you're both focusing on healthier eating. Has there been any change in your exercise habits?
Not really. I've been trying to stay active, but sometimes I just don't have the energy. I guess the uncontrolled sugars play a role in that. It's a cycle, you know?
Yes, it can definitely feel like a cycle. Managing energy levels with fluctuating sugars is challenging. It's good that you're attempting to stay active, as it can significantly help with your overall cardiovascular health and diabetes management.
I've been trying to keep track of everything, but sometimes it just feels overwhelming with all the medications and what I should or shouldn't do.
I completely understand. Let's go over your most recent lab results and see where we stand. Your HbA1c is currently at 8.5%, which is higher than our target, indicating that your blood sugar has been consistently high. Your fasting glucose was 168 milligrams per deciliter today, which is also above our goal. Your cholesterol levels are somewhat controlled, but we could definitely use some improvement in managing your diabetes more effectively.
Yeah, those numbers aren't great. What do you suggest moving forward?
Given your current symptoms and lab results, here's what I recommend. First, we need to monitor your blood sugar levels more closely. I want you to bring a log of your home blood sugar readings when you return in 3 weeks. This will help us understand better how your levels are throughout the day and how we might adjust your medication. Given the forgetfulness with the metformin, adding insulin could help stabilize your glucose levels and reduce the daily fluctuations that might be affecting your energy.
And the chest pains.
Since the nature of your chest pain is different from your typical cardiac symptoms, and given your recent cold, it's possible they're related to the respiratory infection. However, I'm going to schedule a stress test to make sure there's no new cardiac issue we need to be aware of. It's always better to be safe, especially with your history.
That sounds like a plan. I'll try to be more mindful about taking my medications and keeping track of my sugars.
That's great to hear. Let's also continue with the dietary measures you and your wife are implementing. It's important to keep your meals regular to prevent hypoglycemia, especially as we introduce insulin into your regimen. I'll also arrange for you to meet with our diabetes educator to address any concerns you might have about weight management and injections.
Thank you, doctor. I appreciate you helping me through this.
Of course, I'm here to support you in managing your health. We'll review everything in a few weeks and adjust as needed. If you have any concerns before your next appointment, please don't hesitate to contact us.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Good morning. I'm here to assess your readiness to return to work after your injury. How are you feeling today? And what concerns do you have about resuming your duties?
Morning. Well, I'm a bit anxious. My wrist still hurts when I do any lifting or when I try to use it too much. I'm worried it might not withstand the demands of my usual tasks.
It's good that you're paying attention to your body's signals. Have you been able to keep up with the physiotherapy exercises recommended for your recovery?
Yes, I've been diligent with the exercises and they do help a bit, but anytime I overdo it, the pain comes rushing back and it feels like a setback.
That's very informative. Thank you. Let's plan for a gradual return to work. We can start with lighter duties or possibly part-time hours to ensure you don't strain your wrist. How does that sound?
That sounds ideal. I'd appreciate easing back into the full swing of things without risking further injury.
Great. I'll coordinate with your manager and our HR team to arrange this. We'll also set up regular check-ins to monitor your progress and make any necessary adjustments. Our goal is to support your full recovery and ensure a smooth transition back to work.
Now look at question 26.
Welcome, everyone. Today's presentation will focus on the critical role of substance abuse counseling within our hospital. Substance abuse is a pervasive issue that significantly impacts not only individuals but also their families and communities. Our program is designed to provide comprehensive support, integrating medical treatment with psychological and social services. We employ a variety of therapeutic approaches, including cognitive behavioral therapy, motivational interviewing, and support groups. A key component of our treatment plans is individualization. Each patient's journey is unique, and so their treatment must be tailored to their specific needs, background, and circumstances. In addition to direct treatment, we emphasize the importance of aftercare. This includes ongoing support groups and relapse prevention strategies to help patients maintain their sobriety after leaving our care. Our aim is to provide a supportive pathway from initial detoxification all the way to long-term recovery.
Now look at question 27.
We've completed your endoscopy, and I'd like to go over the findings with you. We noticed some inflammation in your esophagus, which is consistent with gastroesophageal reflux disease, commonly known as GERD.
Does this mean I'll need to be on medication long term?
Managing GERD often involves medication to reduce stomach acid and prevent damage to your esophagus. I recommend starting on a proton pump inhibitor. This type of medication will help reduce the acid production and allow the inflamed tissue to heal.
I see. What about my diet? Are there changes I should make?
Absolutely, diet plays a crucial role in managing GERD. Avoiding spicy foods, caffeine, and alcohol can prevent the exacerbation of symptoms. I'll give you a list of foods to avoid and some that can actually help soothe your symptoms.
That's very helpful, thank you. How will we monitor my condition moving forward?
We'll schedule follow-up appointments to monitor your symptoms and adjust your treatment as needed. It's also possible we may perform another endoscopy down the line to see how the inflammation has responded to the treatment.
Now look at question 28.
Thank you for joining today's session on assessing pain in nonverbal patients. This is a particularly challenging but crucial part of our work in providing compassionate care to all patients. To effectively assess pain in nonverbal patients, we use a combination of observational tools and pain assessment scales that are specifically designed for those who cannot communicate their pain verbally. These include the Flax scale, which observes facial expressions, leg movement, activity, cry, and consolability. Our training includes detailed workshops on interpreting these signs and documenting findings meticulously. Accurate documentation is vital for the ongoing management of the patient's pain and ensures that they receive the appropriate interventions. In this workshop, we will go through several case studies to practice recognizing and assessing these pain indicators. It's essential that all staff are proficient in these techniques to improve the overall quality of care for our patients.
Now look at question 29.
Today we'll discuss immunotherapy, which is a promising treatment option for managing severe allergies. It works by gradually increasing your exposure to the allergen, which can help your immune system become less sensitive to it.
How often will I need to undergo this treatment, and what are the chances of success?
The treatment typically involves regular injections over a period of 3 to 5 years. Many patients experience a significant reduction in their allergy symptoms, and some even achieve lasting remission.
That sounds promising. What are the risks or side effects involved with immunotherapy?
The most common side effects are minor and include reactions at the injection site, such as redness and swelling. More severe reactions are rare, but this is why treatment is always administered in a controlled medical environment.
We'll monitor you closely throughout the treatment to manage any side effects and adjust your dosage as necessary. The goal is to maximize the benefits while minimizing risks.
Now look at question 30.
Welcome to today's training session on mental first aid, an essential component of our care services here at the hospital. This training is designed to equip our staff with the skills needed to identify and respond to signs of mental distress in our patients. Mental first aid involves several key steps. First, recognizing the signs of mental health crises, such as anxiety, depression, or acute stress reactions. Next, we approach the person in a non-threatening and supportive manner. It's crucial to listen non-judgmentally and provide reassurance. We then guide them towards appropriate professional help, whether that's counseling, psychiatric care, or other mental health services. The aim of this training is not just to provide immediate support, but also to foster a supportive environment that respects patient dignity and contributes to their overall well-being. By the end of today's session, you'll be equipped with the tools to make a real difference in the lives of those experiencing mental health challenges.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello everyone, I am Dr. Barrett, an acute medical registrar in the southeast of Scotland. Today I'm joined by Dr. Ingrid, who is a post-CCT neurology trainee with a PhD specializing in functional neurological disorders. Welcome, Ingrid.
Thank you very much, Jonathan. I'm excited to be here to discuss such an important topic within neurology.
Today we're focusing on functional neurological disorders, FND. To start, could you explain why this topic is so crucial for not only specialists but also general practitioners?
Certainly, Jonathan. Functional neurological disorders are highly prevalent, being the third most common cause of outpatient neurological consultations. Despite their frequency, there has been a historical tendency to overlook these disorders because they often present with symptoms that don't have a clear organic or structural cause, like unexplained seizures or movement disorders. These conditions can significantly impact patients' quality of life, making it essential for all healthcare providers to understand and effectively manage FND.
That's a compelling introduction. For our listeners, especially those in acute medical settings, could you describe how to recognize FND when a patient first presents?
Great question. Recognizing FND at the initial presentation involves looking for certain positive signs rather than just the absence of neurological deficits. For instance, a common presentation might involve abnormal movements or walking difficulties that don't align with typical neurological patterns. One diagnostic tool is the Hoover's sign for functional leg weakness, where the supposed weakness in one leg improves when the patient is asked to perform a movement with the contralateral leg.
That's interesting. Could you share a relevant case study to illustrate these points better?
Absolutely. Let's consider a patient whom we'll call Sarah, a 34-year-old woman who presented to the emergency department with sudden onset of paralysis in her left leg. She reported that this happened shortly after witnessing a traumatic event. Physical examination showed no reflex changes or sensory loss, but Hoover's sign was positive, indicating a functional cause. Her symptoms improved significantly with distraction techniques during the examination.
That's a fascinating case. How should clinicians approach management after identifying FND?
Management should be multidisciplinary. Educating the patient about the diagnosis is crucial, as understanding the condition reduces anxiety and can mitigate symptoms. Physiotherapy, particularly motor retraining and exercises that shift focus away from the affected limb, is beneficial. Psychological interventions like cognitive behavioral therapy are also effective, especially for patients with trauma-related FND.
And what about ongoing research in this field? Where should we be focusing our efforts?
Current research is exploring the neural mechanisms underlying FND, which could refine diagnostic methods and therapeutic approaches. There's also a growing interest in the genetic and environmental factors that contribute to its development. Ultimately, improving our understanding of these disorders will enhance the care we provide to our patients.
Thank you, Ingrid, for such insightful discussions today. It's clear that recognizing and treating FND requires a thoughtful and informed approach. Any final thoughts for our listeners?
I would encourage all healthcare providers to consider FND in their differential diagnoses when faced with unexplained neurological symptoms. Early recognition and appropriate management can make a significant difference in outcomes for these patients. Thank you for having me, Jonathan.
Thank you, Dr. Ingrid, for joining us today, and thank you to everyone listening. Please feel free to leave comments or questions via our social media channels, and stay tuned for more discussions on important topics in medicine.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today we're diving deep into a critical topic that impacts both clinical practice and patient care, the management of pleural effusion. Joining us today is Dr. Torres, a renowned pulmonologist and a leading researcher in respiratory diseases. Welcome, Dr. Torres.
Thank you for having me. It's great to be here to discuss such an important aspect of respiratory medicine.
Absolutely, Dr. Torres. Pleural effusion, or the accumulation of fluid in the pleural cavity, is a common yet challenging condition. Could you start by explaining why understanding pleural effusion is crucial for healthcare providers?
Certainly. Pleural effusion can be a manifestation of a variety of diseases, ranging from heart failure and pneumonia to malignancies. Each year, we see a significant number of cases where the management of the effusion directly impacts patient outcomes. The complexity lies not only in treating the effusion itself, but also in accurately diagnosing the underlying cause, which dictates the treatment strategy.
That's a great point. Perhaps we could illustrate this with a case study.
Of course. Let's consider the case of a 57-year-old female patient who presented with dyspnea and chest pain. Initial imaging confirmed a large pleural effusion on her left side. The complexity began with the diagnostic process, aimed at distinguishing between congestive heart failure, infection, and malignancy, which are among the most common causes of pleural effusion.
How did you approach this case?
We started with a thorough history and physical examination. Her history revealed no cardiac symptoms or previous cancer diagnosis, but she did report a recent bout of severe pneumonia. We proceeded with diagnostic thoracentesis, which involves extracting fluid from the effusion to analyze its characteristics, whether it's transudative or exudative.
And what were the findings from the thoracentesis?
The fluid analysis indicated an exudative effusion with low glucose levels and elevated lactate dehydrogenase, which steered us away from heart failure. Microbiological stains and cultures were negative, ruling out an ongoing infection. However, cytological analysis showed malignant cells, confirming a diagnosis of a malignancy-related pleural effusion.
This must have significantly impacted your management approach.
Indeed, it did. The presence of malignant cells indicated the need for an oncological assessment to identify the primary source of cancer. It also influenced our immediate management decisions to prioritize symptom relief and discuss long-term management strategies, such as chemical pleurodesis or placement of an indwelling pleural catheter if recurrent effusions occurred.
Dr. Torres, based on this case and your experience, what key points should healthcare providers remember when dealing with pleural effusions?
First, always consider a systematic approach to diagnosis. Thoracentesis should be performed early to guide treatment. Secondly, manage the patient holistically. Consider the implications of the effusion on their quality of life and long-term health. Finally, educate about the importance of follow-up. Pleural effusion can recur, and underlying diseases may progress, requiring adjustments to treatment plans.
Those are invaluable insights, Dr. Torres. Thank you for sharing this detailed case study and your expertise on managing pleural effusions effectively.
It was my pleasure. Thank you for giving me the platform to discuss such a vital topic. I hope our discussion helps improve patient care and outcomes in this complex field.
I'm sure it will.